Why don't we get started? So good afternoon, everyone. Thank you for joining us today for this webinar. I'm Adara Citrin, CHBRP's Associate Director.
And I'm Anna Pickrell. I'm a principal analyst with CHBRP.
So today we'll share with you all an overview of CHBRP, the types of bills that we analyze and how we do those analyses, a bit about the California health insurance landscape and what you can expect if a bill you are involved with is sent to CHBRP for analysis. We'll also include a review of helpful resources we have available on our website. We have lots of time for questions at the end, and feel free to add your questions at any time to the Q&A section of the webinar. And then we'll also have these slides and a recording available on our website after this is over. Next slide. Perfect. So for those of you who are newer to us or would like a refresher, CHBRP was established in 2002 through California legislation and conducted its first analysis in 2003. We receive requests directly from the legislature to analyze health insurance benefit and other health insurance related legislation. These requests typically come from the Assembly or Senate health committees, but may also come from the appropriations committees or others in leadership. CHBRP's primary charge is to provide neutral, evidence-based analysis of legislation, but we also provide other resources on health insurance policy for the public. We are always available to help folks understand our work or answer questions about health insurance and benefit mandates more generally. Some things that CHBRP does not do includes making policy recommendations, providing opinion-based analysis, or selecting which bills we analyze. As I just mentioned, these requests come directly from the legislature. CHBRP is also funded through an assessment on health insurance offerings in California and does not receive funding from the California General Fund. Looking at what is a health insurance benefit mandate, there are typically three types of mandates we see. The first is a bill that would require coverage of a screening, test, or treatment for a particular disease or condition. An example would be requiring coverage for screening and treatment of breast cancer. The second is a bill that would require coverage of a specific test, treatment, or service. For example, requiring coverage of insulin. The third type of mandate is one that requires coverage from a particular provider, such as requiring coverage for services from a licensed acupuncturist. CHBRP is also charged with examining repeals of mandates, although this has become rare in recent years. There are several other types of healthcare legislation that CHBRP may be requested to analyze. Other common requests include terms and conditions of coverage, such as cost sharing, utilization management, limits on coverage, or parity requirements. We will look at reimbursement rates, and sometimes we will also look at health insurance financing. To give you an idea of what our analyses look like, every analysis will provide some context to give an overview of what is happening at the state, federal, and sometimes local levels related to the policy in question. We also give some background on the subject of the bill. Just a warning, we are not lawyers. We are tasked with making reasonable interpretations of each bill that is referred to us. We do reach out to the Departments of Managed Healthcare, the California Department of Insurance, and the Department of Healthcare Services to ask questions about bill interpretations. Next, we examine the medical effectiveness of the tests, treatments, and services by included in the bill by looking at the existing evidence and providing a grade for it. Is this treatment effective? Is there really strong evidence? Is there some evidence? Or is there not enough research to make a conclusion? And so on. Finally, we estimate the cost impacts in the form of premium and cost sharing changes, as well as the public health impacts on a population health level. We do have videos available on our website that provide more information on how to read a CHBRP report and other good CHBRP tips. Our bill analysis process begins with a formal request from the legislature to analyze a specific bill. We begin our analysis the next day. At this point in time, we post the request to our website, send an announcement through our listserv, and begin accepting submissions from the public of information for CHBRP to consider in the first 2 weeks of the analysis. We complete our analysis within 60 calendar days, although some requests are asked to be done in less time. Our goal is to provide the analysis in time for the bill's policy committee hearing. We send the final bill analysis and corresponding materials to the legislature and post them to our website. To analyze bills in this short time frame, we leverage our multidisciplinary analytic teams to provide rigorous, objective analysis of all bills for which we receive a formal request. CHBRP staff manage and facilitate the teams and ensures that reports come together as a cohesive whole. CHBRP staff are also responsible for writing the policy context, and we manage external relationships, contracts, and administrative operations for the analyses. CHBRP is available after the completion of our analyses to answer questions and track amendments beyond day 60 as the bill moves through the legislative process. We attend committee hearings and are responsive to follow-up questions as bills evolve. In some instances, CHBRP is formally requested to provide an updated analysis based on amendments to the bill. Depending on the scope of the amendments, these updated analyses can usually be completed in a shorter period of time. CHBRP has a core team of 4 full-time staff, which works year-round creating publications, prepping our models and templates, and more to get ready for our busy season. To complete the analyses of bills, we collaborate and work with several other groups of experts, including about 40 faculty, staff, and researchers from several University of California campuses and other higher education institutions. We have a dedicated team of research librarians to ensure that our medical effectiveness analyses incorporate the most relevant research. We work with Milliman to ensure that our cost estimates are built from a robust, up-to-date cost model and use representative claims data. We also work with content experts to help us provide additional background and context for our work and make sure our estimates and assumptions are reasonable. Our National Advisory Council gives another level of internal review to ensure our analyses are neutral and reasonable. We also have a group of students that help support us throughout the year. All members of our team abide by a pretty strict conflict of interest policy. So as I mentioned, our task force of faculty and researchers spans many University of California campuses, and actually we have representatives from 7 campuses. This ensures that our analyses of state-level bills benefit from statewide expertise. And with that, I will hand it over to Anna.
All right, thanks, Adara. I'm going to talk a little bit about CHBRP's purview. So we primarily look at impacts of legislation on state-regulated insurance. This is a little bit over half the population of California, which in 2026 is about 23 million lives. We largely do not analyze bills' impact on federally regulated insurance. So that includes things like Medicare. Many of the bills that CHBRP analyzes do not impact all Californians directly. Rather, they are designed to change coverage for certain markets. So this slide shows the markets typically included in a CHBRP analysis. They are large group, small group, individual market, Medi-Cal, and CalPERS. Many bills do not apply to all of them. Some do, but some, for example, are written just for Medi-Cal, or others might apply only to the large group market, and some might specifically mention a couple of, some combination of those markets. We're giving a presentation on February 12th that will provide more information about these markets and some other health insurance 101 topics. So if people want to learn more about what these markets are, the differences among them, who they impact, join us on February 12th. Our expertise is vast, and we are able to analyze bills across a wide variety of topics. So this slide mentions a few recent ones just from the last couple of years, and as you can see, they cover a range of topics from things like menopause and perinatal health to human milk, Medicare supplements, fluoride treatments, insulin, among many others, some on this slide, and many, many others not. So what can you expect to work, when you are working with CHBRP? There are a few things to consider if your bill might be headed to CHBRP for analysis. The first is that the more fully baked a bill, the better. It's tricky for CHBRP to incorporate amendments or changes once we've begun our 60-day timeline because it moves very quickly. So if you know early on that there will be changes, please let us know. We do require a formal lead counsel RN if amendments are going to be incorporated into our analyses. We encourage you to talk with the health committee about whether or not your bill would qualify for a CHBRP analysis. Per a letter from the health committee chairs, in order for a mandate bill to be heard before the policy committee deadline, this year the health committee should request a report from CHBRP for any given bill by February 14th, which is coming up. Um, and any legislative office considering a new state mandate is urged to first consult with committee staff and be mindful of the CHBRP review process. Our website has all of our previous analyses along with the bill language that was analyzed for that analysis. We encourage people to look through them to get a sense of the kind of work we do because that might help you determine whether your bill is a good candidate for a CHBRP analysis. You can also look through our library of completed analyses to determine if a bill you're working on covers a topic that we have analyzed recently. In that case, if you do find, a similar analysis, we encourage you to look at the findings and the impacts. So what happens when your bill goes to CHBRP? One of our early steps in analyzing a bill is to meet with the bill author's office to answer clarifying questions that our team has about the bill and our interpretation of the language. CHBRP staff will reach out to schedule that meeting quickly. The earlier we can have that conversation, the sooner we can move forward with the rest of our analysis. CHBRP staff will send a list of questions that we want to discuss in the meeting in advance so that your office has time to prepare for the conversation. And bill sponsors who can help answer those questions are welcome in these meetings and do often attend. So that's encouraged. We accept information submitted by the public within 2 weeks of receiving a request, and we look at everything that is submitted. That said, documents that are submitted may or may not actually end up in the report. For example, sometimes we receive a study that is already included in our literature review, but we do not include documents that are not neutral in their relation to the legislation in order to maintain neutrality in our reports. Like I said, we will consider and incorporate any necessary technical amendments, but we must see them in an RN. And we are available to provide a briefing of our analysis to the bill author's office after the analysis is complete. But a reminder, we don't offer policy recommendations, so that won't be a part of that conversation. So what do you receive when you get a CHBRP analysis? When we complete an analysis, we post to our website a complete bill analysis, a key findings document, which is a short summary of the analysis, and then a 1 or 2 page infographic for each request. We also post to our social media accounts when each analysis is complete and posted online. I'm going to talk a little bit now about some of our other publications that are not bill analyses, because as Adaira mentioned, we do other things throughout the year. There are sort of 3 different levels of depth and complexity in the non-bill analysis publications that we create. First, we have a glossary and what we call our nuts and bolts. So we have a glossary on our website with key health insurance terms that we keep updated. It is linked here. You can also find it on our website. It is pretty comprehensive. We also then have publications that we call nuts and bolts. They are a high-level snapshot of key health insurance topics. They are usually 1 to 2 pages, tend to contain visual aids to explain all kinds of topics. Some of the recent ones being California's proposed 2027 EHB plan, one on AB 144, one on kind of newly created state health alliances. We have a timeline of the HR1 Medicaid provisions. a nuts and bolts on sources of health insurance in California, one on enrollee healthcare expenditures, and many others. The next level of depth or complexity in our publications are what we call explainers. They are a little bit longer and more in depth that kind of deep dive onto and provide more background and definition on healthcare topics. We develop explainers based on topics that are frequently discussed by the legislature or in the healthcare field. Some recent examples here include an overview on health insurance in California, one explaining what is cost sharing, another that is an overview on utilization management, one on OCA, a fairly new one on Medi-Cal RX, and another kind of overview of the drug supply chain. There are many, many more on our website. These all, I believe the ones I mentioned were all published this year, and there are others that are new this year and some from previous years. The next level of depth includes our resources, our issue briefs, and our policy snapshots. So these publications help build a deeper understanding of some of the kind of hot topics in healthcare. Their length varies, but tends to be longer than our explainers, and they're again cover a wide range of topics. Our resources are updated annually with publicly available data and data collected from the healthcare plans and regulators. So we refresh the information in these every year. Some examples there include, again, sources of health insurance in California. There is one that we just updated on federal and state preventative services benefit mandates, one on pharmacy benefit coverage, one on deductibles in state regulated health insurance, again, among some others not listed here. Our issue briefs and policy snapshots are similar to our resources in their level of depth, but they are snapshots of topics in time. They are not updated over time. Some examples here include a new one on AI and healthcare in California, another on outpatient prescription drug cost sharing, one on telehealth, one on medical necessity determination processes, and some others from years past. And then finally, if you can't find a resource, an explainer, a nuts and bolts, what have you, on our website on a topic you think is interesting that your office would like to learn more about, your organization would like to better understand, we are open to suggestions for topics for other publications. So please reach out. You can email us at info@chbrp.org, or you can find us on social media, and we are open to those suggestions. So, like I said, reach out. There's a QR code here for our listserv. We have a quarterly newsletter. We also send out invitations to or announcements of webinars like this one, webinars on other topics that we provide throughout the year. We also send out emails on our listserv whenever we get a request for a bill analysis, as well as when we complete one. And stay in touch on social media. And that's about it for today. So I think we will take questions now.
Thanks, Anna. We have one question already in the chat, and feel free to add others. So this question asks, how common is it for CHBRP reviewed mandates and repeals that are proposed by the legislature to actually pass and then move on to enforcement? And it really varies. There are so many considerations outside of the CHBRP process that determine whether a bill is signed by the governor and then implemented. Based on the bills we analyzed last year, we analyzed 13 bills. One was signed by the governor. There were several that didn't make it to the governor's desk that he then vetoed. And then there were others that did not make it to the governor's desk for a variety of reasons. We do have a page on our website. It's called Analysis and Amendments. No, it's called Amendments and Analysis Updates. And this page lists the analyses we completed within a specific legislative cycle and then what their status is. So for the bills that we analyzed last year, and then also for bills we've analyzed in previous legislative sessions, it will list the final status of those bills. So if it was signed by the governor, if it was vetoed, and then it also includes a short summary of how relevant CHBRP's analysis remains to the final version of the bill. As we were both talking about, as bills are amended, the impacts may change. So this provides a quick overview of which portions of CHBRP's analyses remain relevant. And usually the answer is most of the analysis remains relevant because of that helpful contextual information, the review of the medical effectiveness literature, and usually directionally, the fiscal and public health impacts are also still relevant.
And I will just add to that point, Adara. Sometimes bills are amended such that if you are a staffer working on a bill and post CHBRP analysis, it is amended and you want to understand how that impacts our analysis, reach out. We can provide, with an understanding of that in, maybe more depth than what we are able to put on our website. Or sometimes, reach if you want to reach out quickly before we try to post that to our website pretty quickly. But if you have follow-up questions about that, about how much of an impact, we can answer those questions.
Great addition, Anna.
And then I have one other thought on that if we don't have other questions, which is I was saying earlier, look at the old analyses on our website. Every full analysis contains the version of the bill language that was analyzed. So if you're looking historically and you look at the bill history, and you're trying to understand which version of that bill CHBRP analyzed, sort of, match the language with the analysis, that information is contained in the appendix of our analyses. So you can figure that out pretty easily.
Do we have other questions from attendees? Oh, great. Okay. How do you determine the scope or maximum number of webinars or non-bill analyses you take on each year? And do you wait to commit to other efforts until you know how many bills you'll get? Anna, would you like to take this one?
Yeah. Okay. So to the first question, how do we determine, sorry, was it how do we determine the number or which ones?
The scope or
Oh.
maximum number of webinars or non-bill analyses we take on each year?
Yeah, I think in terms of volume, it's really about our staff's capacity, as well as what our partners are interested in. So a lot of our webinars, we partner with, say, the UC Sacramento Center or something like that. So that's, a partnership that we work with them to determine when we want to do that, what topics we want to, we have mutual interest in, and how much capacity we have that for that in a year. Determining scope, I think, really depends on what the topic is, what existing resources might already exist on it, and where we can add value. So if there is a topic where overviews already exist somewhere online and what we really could add to the table is a lit review, is an issue brief, something like that, that's how we will think about that. And then I think the second question was about how do we spread it out throughout the year, basically, or combine it with taking bills?
Yeah, and
Yeah.
how that plays into it.
Yeah, great question. Our season for bill analyses is really January through April. And we don't tend to do a lot of the other publication work during that time because the bill analysis process takes up basically all of our staff resources. So we focus our efforts on those other publications the rest of the year. So that's when that happens. And we sort of switch back and forth that way.
And I'll add to what Anna was just talking about as far as how we decide what to work on. We collect ideas throughout the year. Some of the ideas come from when we're doing the analyses of legislation, and we have a question that we just don't have time to dig into because we move so quickly during a 60-day timeline. So we'll save that question and add it to our potential list of projects for the summer and fall. We also conduct meetings with our stakeholders during the summer months. And one of the questions we always ask is, what types of resources can CHBRP provide to, answer questions that you get? Or is there something that CHBRP can do to provide clarity on a complex topic? Or what are you seeing that people are struggling to understand? And so that's another place where we collect that information, and then we'll gather as a team and decide, what the priorities are for those projects and what capacity we have available to do those projects. We have a follow-up question for the student internship opportunities. Are interns assigned to work for a specific bill, or do they get to work on multiple in one summer? Because as Anna said, we do most of our bill analyses during the winter and spring. So when students join us over the summer, we're not working on bill analyses usually. So students work with us on those other publications that, based on the ideas we've gathered during our busy season and then during meetings with stakeholders. We do not have a shortage of work. So there are always interesting things to work on. And we try and focus our efforts on what would be most helpful for the legislature, for staffers, for other policymakers, and for others who are, involved in health insurance legislation in California.
I'll also just add, Adara, because this was not in this presentation, but we do have a couple of positions open for summer internships right now, and the applications close tomorrow. So if you're interested, please apply today or tomorrow.
Well, those look to be all of our questions. If anyone else has questions, please reach out. You can reach out directly to me or Anna to the info@chbrp.org email address. Our contact information is available on our website. And then, as I said, a recording of this webinar and the presentation will also be posted to our website shortly. So thank you all so much for joining us. We hope this was helpful. Please provide any feedback you have via email. We're always open to adding more content and improving this webinar. So take care, everyone.
Thanks, everyone.